Good morning, everyone. My name is Amina Gorman, and this is my presentation on the developmental trajectories of antisocial personality disorder during childhood and adolescence. So first, here is a brief outline of everything that I will discuss in this presentation. I will first discuss and define antisocial personality disorder and help understand exactly how the disorder is diagnosed and what are the most common traits that are associated with it. After this, I will acknowledge what my knowledge gap is and speak to exactly what this review does to try and fill this gap. This will include discussing the risk factors that are associated with the development of antisocial personality disorder, as well as the protective measures that can be taken in adolescence to lessen the likelihood of developing ASPD in adulthood. So here's a quick crash course on exactly what ASPD is. Antisocial personality disorder, otherwise known as ASPD, is a personality disorder characterized by behaviors such as a failure to obey laws, a lack of remorse, and physical aggression. It is a serious public health concern due to its increased risk for violent criminal behavior. Later in this presentation, I will discuss exactly some statistics involving the heightened percentage rates of ASPD in the prison systems in the US. Candidates for an ASPD diagnosis must be 18 years of age or older, with a prerequisite diagnosis of something called conduct disorder. Now, conduct disorder must be diagnosed before the age of 15, and some of the criteria that are associated with it are frequent initiation of physical fights, deliberate fire setting, deliberate destruction of property, physical cruelty towards people. All of these actions can be extremely detrimental, not only to a child, but to their environment as a whole, which is why it is extremely important to figure out exactly how to mitigate the risk factors that influence the development of both conduct disorder, as well as the potential for it to develop into antisocial in adulthood. So ASPD by the numbers. In the US population, 4.8% of males meet the criteria for ASPD, while 1.2% of females meet the criteria. This number drastically increases when looking specifically at the prison systems in the US, where around 26% of incarcerated females meet the criteria and 37% of incarcerated males meet the criteria. This is once again why it is so important to understand exactly how ASPD comes to be, because it does have an increased risk for violent criminal behavior. Now, ASPD is multifactorial, and about 40% of its development is attributed to biological factors, but it also has connections to adverse childhood experiences such as abuse and neglect. Finally, factors such as coercive parenting, isolation, and other social interactions have also been shown to have drastic effects on the development of ASPD. The purpose of this paper was to elucidate modifiable socio-environmental risk and protective factors of ASPD, as well as to educate the public on its early intervention among youth with conduct disorder. Now, the knowledge gap that I recognized through my research was that there was a large body of literature that discussed specific misconduct traits and intervention methods for those traits in adolescence. However, there were not very many connections made between those traits and specific disorders, likely because there was a lot of overlap between the traits and different disorders, and you don't want to overgeneralize for a specific trait being only connected to one disorder. Now for risk factors. It is vital to understand the factors that may potentially increase the likelihood of developing ASPD or exacerbate pre-existing conduct disorder traits in adolescence. Parenting methods used regarding child discipline have been shown to carry lasting effects on the behaviors and traits of a child exhibiting in adulthood. Now, authoritarian and neglectful parenting styles are the most prevalently seen styles in households that raise children who end up developing ASPD. Ostracization from peers in adolescence can have extremely negative effects on the child's ability to self-regulate, in turn affecting their peer relations. If children do not gain experience in self-regulation, they may be labeled as weird and be even further isolated from their peers, creating a negative feedback loop. This social isolation creates a desire for peer relationships, but often these individuals identify peers with similar social challenges or conduct issues. As these children interact with other antisocial children, they reinforce their own antisocial tendencies, which further perseverates the issue. Now, for the protective factors that I discovered, Home life and school life are two critical elements of protecting against conduct disorder and ASPD. Studies have shown that abuse is often cyclical, and there is around a 40% likelihood that the abused become the abusers themselves. Similarly, in school environments, interactions in a non-familial social setting are critical. When school settings are not conducive environments for these interactions, it can become a risk factor for the presentation of conduct disorder. In both of these cases, the role that adults play in the development of children cannot be understated and must be recognized. With all of this in mind, how do we break the cycle from conduct disorder to ASPD? One viable approach that has been investigated is the use of group therapy involving an entire family. This helps increase the accountability of parents in the management of their child's conduct disorder. To summarize, socialization matters. Parents, teachers, and peers shape a child's development. Limited social interaction reinforces exclusion, which can lead to negative peer perceptions, and authoritarian parenting can worsen conduct disorder symptoms, creating a cycle of resistance. In future review articles and potentially in future studies, the connection between the severity of conduct disorder and the environment that the child grew up in should be further elucidated. If done, we could shape our environments, whether home or school, to mitigate the risk of conduct disorder and the potential transition to antisocial personality disorder. Thank you so much. Here are all of the sources that I cited both in my paper and in this presentation. Does anyone have any questions?
Yes, thank you so much, Amina. That's very impressive. So now let's take any audience question now. Let's see. Okay, we have the first question. Right, yes, that's a great presentation. I agree. Have you read about example where adults can still recover from ASPD if they don't have an
That is
intervention earlier?
That is a great question. I haven't necessarily read about any recovery of ASPD at all. Um, that's not really something that I've seen being possible, but there are ways to mitigate the risk factors associated with ASPD. Um, and I haven't seen as many opportunities when there weren't interventions in early adolescence and in childhood. And most of those cases are the cases that are seen in the prison systems in the US. But that is a great question.
Thank you. We have another one. Did your research uncover any link between conduct disorder or antisocial personality disorder and prenatal drug exposure?
That is also a great question. I did not see anything specifically talking about prenatal drug exposure. A lot of the research that I did kind of happened outside of the womb, like after birth, the effects that happen after birth, as well as genetics, but there weren't any connections that I saw to things that happened during pregnancy. But I do
Yes,
think that that is something that I can look at.
perfect. And we have another question. Did you find any connections between childhood environment and future diagnosis?
Yes, I did. Especially with children who are already predisposed to conduct disorder, the environment that they grow up in is especially important in their very early stages in their development of both conduct disorder as well as ASPD. So home life, as I said earlier, authoritarian parenting, neglectful parenting. There's also something called coercive parenting, where parents go back and forth with their child, trying to convince them and kind of arguing with them. And eventually, most of the time, the child ends up winning, which reinforces specific ideas into their minds. And that also kind of builds up to conduct disorders and eventually, potentially, ASPD.
Yeah, wonderful. And we have another question. Is there a correlation between the antisocial leaders and antisocial followers and the point of the development of their disorder?
I think that's a great question. I haven't done a lot of research on this, but something that I would think is there's one specific point where I talked about social isolation. Some children who are socially isolated by their peers in adolescence they decide to just stay isolated. They isolate themselves. And I think that those would be more of the people who end up being the antisocial followers, as you say, while the people who kind of form a group with similarly antisocial children, they continue to build their antisocial tendencies off of each other and kind of like learn from each other. And so I think that those would be the people that end up being more of the antisocial leaders in your phrasing.
That's an excellent answer. And we have the last question. What do you think of the current trend of gentle parenting as a cultural shift in parenting styles?
I think that gentle parenting is actually a really great way to not only parent a child, but also parent yourself because gentle parenting involves constant like understanding of how you are speaking to your child, how you are interacting with your child, and that kind of brings back to the idea of the group therapy and the family therapy where the parent is actually taking an active role in understanding how their parenting affects their child and how it affects their development. And so gentle parenting is kind of a moment for parents to step back and really understand that the words that they say and the things that they say have an effect on their children and kind of understanding exactly how to navigate that.
Yes, and actually we have another question. What are the recidivism rates of incarcerated individuals who have been diagnosed with ASPD?
I'm not sure what recidivism means, but other than that, there was 26% of females in the incarcerated system, as well as 37% of males who have met the criteria. But because it is very hard to kind of diagnose people officially because of the prison systems and the way that the medical systems are set up in prisons, that statistic is a little bit shaky because there's a lot of kind of reoffenders upon release.
Oh,
Okay, that makes sense.
yeah.
Okay. Um,
Mm,
that that is a great question. I have not researched that specifically, but I do think that that would be an interesting thing to kind of look on and see like how often it happens.
okay. Yes. Thank you.